The next update we'll be looking at will have to do with the risks of hypertension with first-line dolutegravir and tenofovir alafenamide, that is TAF, in the NAMSAL and ADVANCE trial. So, Prof, is hypertension something that you have noticed in your practice with your patients?
Do you know that I think I'm guilty of not reviewing program data? Every day we take the blood pressure of our patient and we have voluminous data that we can actually look at. I'm really very fascinated at this finding of the topic you want to discuss, risk of hypertension. Maybe it's going to be an eye opener for us to go back and look at our own data. Maybe the same thing is there. What we are aware of is dolutegravir and hyperglycemia, obesity, stuff like that. But that it may be associated with hypertension is something that I'm really looking forward to see the data that we have to share.
Yeah. So as we look into the data by Dr. Bosch and his colleagues, this is something that we can easily review back. I'm just agreeing with you. Each time our patients come to the clinic, for clinical visits, we check their blood pressure. So this is something we have data, a longitudinal data on, and we can really tell. All right, so let's see. So by way of a background, hypertension we know is prevalent in sub-Saharan Africa, and it's a leading cause of mortality, actually. And the use of tenofovir alafenamide and dolutegravir have been found to be associated with higher risks of clinical obesity than in using other medications like efavirenz. So this study actually just determined the risk of hypertension between dolutegravir-based regimen and efavirenz-based regimen, both of them. So that's what we'll be reviewing. By way of a trial design, the NAMSAL trial design, it looked at about 613 participants, and they were all HIV treatment naive, and they had a viral load that was above 500 copies per ml. Blood pressure was measured at every visit, and in this trial, hypertension was not routinely treated. Whether it was measured and kept, there was no routine treatment. So the patients were randomized into two arms, those that were on tenofovir, lamivudine and dolutegravir, and then tenofovir, lamivudine, and efavirenz 400 milligrams. They were 310 and 303 respectively. Again, blood pressure was taken at baseline, and then 4 weeks, 12 weeks, 24 weeks, up to 192 weeks. So the mean systolic blood pressure change over time is depicted in this graph, and essentially what we can see is those on the DTG-based regimen versus the efavirenz-based regimen. We can see the gradual difference. There's equal to about 6.5 millimeter of mercury difference in the systolic blood pressure across board during the follow-up. So DTG, those on the DTG-based, statistically significant difference, as we can see.
You mean that those on DTG have consistently
higher systolic blood pressure, yes,
compared with those that are not on DTG containing
yes,
regimen?
those that were on efavirenz-based regimen consistently. And this is from the NAMSAL trial. And for the advanced trial, which we looked at in our earlier presentation, essentially the same inclusion criteria with the NAMSAL. And what they were looking at here is looking at what they describe as treatment emergent hypertension, grade 1. In other words, those that were not hypertensive and became hypertensive as they were on this treatment. And again, for the advanced trial, remember that there were 3 groups. Those that were on tenofovir alafenamide with emtricitabine and dolutegravir, tenofovir disoproxil fumarate, emtricitabine, and DTG, and then tenofovir disoproxil fumarate, emtricitabine with efavirenz. The same, they were followed up from baseline, 4 weeks, 12 weeks, and looking out for treatment emergent hypertension. Just like in the NAMSAL study, the mean systolic blood pressure change over time again was higher in the two groups that had dolutegravir as opposed to the those that were on efavirenz. It's even higher with those that were on tenofovir alafenamide with DTG versus those that were on tenofovir disoproxil fumarate, which is TDF, and DTG. So, but the least systolic blood pressure change was in those on efavirenz. So, the take home from this study is in both NAMSAL and the advanced trials, use of DTG was associated with significantly higher risk of treatment emergent hypertension, especially in those that had the combination of TDF and TAF and DTG. Very, very instructive. This is instructive. And then in the NAMSAL study, where hypertension was not consistently treated, risk of hypertension remained higher, even still in the DTG group versus the efavirenz group. So in advance, most cases of hypertension were treated, so that was very nice. So Prof, as we round up, what do you think and what do you do? What is your advice?
I think this data is very instructive to clinical practice. What it means that we should be looking at the blood pressure of our patients over a period of time. They follow this patient up to 182 weeks.
Yeah.
And those that are, on DTG containing regimen happen to have treatment emergent hypertension, and that is very instructive.
Yeah.
And I think that is what we should be talking about now. Look into our data and integrate treatment of hypertension into the routine HIV program before it becomes a malignant hypertension. And I can see that in your advanced trial, it appears that patients were treated as they were developing hypertension. That is good. And we should just replicate it in routine practice. Thanks for sharing the data.
Very important. We need to consider it's not enough to just treat the HIV. We need to look at the other comorbidities, and this is becoming very evident and clear from these trials. So it's something that our guidelines need to talk about and be strong about. Thank you very much.